This is Martin Peter with GetReal.tv. I'm outside the Eisemann Center in Richardson, Texas. We just saw a forum with 4 Republican congressmen. It was a very interesting 2 hours. We are outside now. We have a David Shapley. We're visiting with David. David, tell us a little bit about yourself and what you think of health care reform.
Well, I'm a classical homeopath. I've been educated in a 4-year program on a healing modality that was very successful in this country 100 years ago when it was a free market. And basically my viewpoint is that the free market is the solution for health care, and that we have not had a free market in health care for nearly 100 years. And it's a long progression, but it started when MDs went to the government and got licenses in order to give themselves a monopoly and crush out their competition, and then to lobby and pass laws to push out alternative health care providers like me, or keep us from being able to use their language like curing or treating disease, and then make it illegal and make it difficult for us to compete with them. My idea or solution for health care is to return it to a free market, and I've got basically 4 points, very simple points that I think would do that. Number 1, get rid of medical licenses granted by the state and return it to the private sector interest. They could be certified through private organizations as to their credentials. Number 2, allow alternative health care practitioners to compete openly with them and to negotiate prices, and you will watch the prices fall. Number 3, don't allow insurance companies to insure medical procedures that go beyond catastrophic disaster. That's what insurance is for. It's not for treating sore throats. And number 4, allow private charities to pick up the rest. If those 4 steps are followed, healthcare will be affordable to 99% of the people. And because everybody's having to compete for the healthcare dollar in the marketplace, quality will improve. Monopolistic and harmful treatments that are just based on theories and not on actual results will disappear from the market. The authoritarian view will subside, and a more vitalistic and more holistic approach will become normal in the country.
Is there any country in the world now that uses the system that you just described with your 4 points?
I don't know of any country that is doing this now. This is the way it was in 1865 or 1875 or 1910. India is a lot more open to alternative practitioners, but they still have a lot more government involvement, and it still keeps costs up, though it is much less expensive than it is here just simply because of their lower standard of living. Homeopathy and other alternative practitioners do operate in Europe, but they are not allowed to participate in the national health care system. They have to stay in the free market, and therefore they have to charge out-of-pocket cash for their service. So you know, the ideal mode to me would be to put it like it was in 1895, where you had many different modalities competing, and incidentally what we call modern medicine was the allopathic method of using surgery and suppressive treatments was not the favored method, and they've always hated the free market, and so they were the first ones to run to the government and get the whole government involvement going. So you know, they're always against having to face the marketplace and sell what they do and allow the consumer to be the final authority as to what's best for their health.
Do you think you have a long, hard row to hoe?
I think the issue will be solved correctly. Either we will do it voluntarily, or circumstances and pressures will build up and to where people are just forced to take responsibility for themselves in the current economic and political environment.
So more individual responsibility?
Individual responsibility with the healers and practitioners and with the people. We all know that, you know, a good 90% of the illnesses that happen are actually due to our own self-abuse and our lack of self-control. And you know, when people believe that that's all going to be handled by some higher authority, they really don't pay attention to themselves. They don't really watch the consequences of their thoughts and their actions and their emotions in life. And I believe that the holistic or spiritual view of life is that everybody will face the consequences of their choices, and those consequences are what teach us to pay attention, what teach us to adjust our lives and to be more balanced.
So basically the healthcare system we have today kind of disconnects people or their behavior from their outcomes. Is that correct? from a healthcare standpoint.
From a holistic standpoint, yes, and it's not just in healthcare; it's in all forms of limited liability and promising people that somebody with authority, is going to relieve them of their responsibilities.
Makes a lot of sense. Listen, thank you very much for speaking with us this evening. You'll be able to see this on YouTube and also on our website, getreal.tv.
Thank you very much.
Thank you, David.